Dear participants of the 38th World Veterinary Association Congress, welcomes Ukraine. First of all, I would like to welcome your participation in this global important event. Ukraine also participates here, of course, due to their war limitation. There is no possibility to welcome you in person. However, today I would like to make some intervention to get you know more about what is happening in Ukraine and what is Ukraine's role in a One Health approach. Food security is an important issue for Ukraine because we not only the food safety responsible authority, we also responsible for food security, global food security, because Ukraine is one of the biggest agriculture country and we export a lot. Let's come back for February 24, 2022. This peaceful day we will never forget. This peaceful day and life of million peoples, of Ukrainian peoples, has changed into the 430th day of February, the longest February in our history. Before my intervention will start, I would like to share and present with you some photos of consequences of Russian aggression in Ukraine. The Russian occupiers indiscriminately assaulting civil infrastructure, destroying logistical links, shooting, and attack civil society and civil infrastructure, food warehouses, food business operators, livestock, zoos, farms, and many others. These photos are reality for many Ukrainian children, citizens, farmers, animals owners, businesses, and many other related and suffered from Russian aggression. Despite all presenting, government and competent bodies I'm presenting the State Service of Ukraine on Food Safety and Consumer Protection have and conduct daily activities in order to provide animal health and food safety as a part of global food security. Ukraine keep to maintain the status free of food and viral disease country in the world. There is no cases of avian influenza, there is no cases of many other diseases registered in Ukraine. It's because of the work of the many veterinarians, governmental and private in the places who conduct their daily activities in order to prevent the spreading of animal diseases, plant diseases, to conduct food safety of the products, testing the products which we consume and exported to our trade partners. We do the clinical inspections of animals. As the part of One Health approach, veterinarians are the first people in places who knows about the clinical science and clinical physical status of animals, who working with farmers, who working with poultry production and many other facilities. They monitor diseases, they do the necessary measures to prevent diseases, vaccination, treatment of animals, of agriculture animals and of pet animals and many other types of zookeepers. And the photos you saw, no diseases or no any influence on the population of animals can cause by the wars in these challenging times. I would like also to share with you some numbers and of losses of agricultural sector that suffered for the last 2 years in Ukraine and the lessons we learned. Of course, One Health approach, it's a wide number of inter-bodies communication. It's human health, it's animal health, it's environment, it's food safety. And all of these areas are covered all together in general global initiative for One Health approach. For today, the main challenging war suffering issues are damage of places for animal burying, problems with proper animal carcasses disposal, food wastes, animal population reduction, contaminations of water sources and environment, migration of animal and poultry that can lead to spread of diseases. mining of lands and sites, no possibility to having wheat and grains raised for the next year. Another point of learned lessons I would like to share is importance of private veterinarians who support the governmental activities when we're saying about the combating of diseases and preventing of diseases. My trust to what they're doing, especially now when we have the bordering regions and were suffered from occupation in Ukraine, veterinarians didn't leave the places and didn't move to any safe regions. They stayed to monitor animals, to help people, to treat cats and dogs, to treat zoo animals, help them to transfer to the safer places, thinking about the mentality and safe conditions, not only for the health point of view, but also for animal welfare, not to suffer from loud sounds, mining, and all what is happening based on the numerous attacks for Ukrainian territory. This is only the partial problems what we have for today in Ukraine in this war period. And I only briefly shared with you our day-to-day activities of supporting One Health initiative in Ukraine despite the fact of war. More steps, of course, need to be done after the occupation of the regions of Ukraine. And in the framework of the animal health, food safety and welfare, we have a lot of work to do in places by governmental and private veterinarians supporting the renewal of population, helping for renewal of the logistical issues, supplying veterinary drugs, helping with many restocking that the normal life can be back. Despite all changes that influence on Ukraine and its nations, we are strong. Our army leads us to the victory. And the main task for state bodies, for governmental, for our service and for private sector to have stable economics, food safety, animal health, plant health, welfare, environments under the scope of One Health. Thank you. Have a good discussion.